If you have neck pain and you're a golfer, this video is for you. We're gonna go through a couple different ways to help manage and improve your neck motion with golf. Reason this is so important with golf is that is what is gonna allow us to focus on the ball throughout the entire swing process. We need to be able to focus on a point, hold our neck still as we rotate through our body. So if you actually look, instead of having our head turn on our body, we have our body turn on our head as we go through that golf swing. And same thing on that backswing. So if you pull your head too much, you can't look to the right, you'll lose the ball at contact. That can cause a lot of issues. Same thing, if you're going through your backswing, you can't look to the left, you lose sight of that ball, you have to re-find it on that downswing as you're coming through. So this is one of those ways that you can really help improve your golf game by just improving your neck mobility overall. So if you have any issues looking left, looking right, this is going to be a good way for you to get everything together and get things moving so you can improve that game. We're gonna start off with Theracane. This is one of my favorite tools overall. It's very versatile to help get the neck moving. So all I'm gonna do is we're gonna start with a little ball and it's gonna go just off to the side. So you have little bumps on the spine. We're gonna sit just off to the side of those. From there, we're just gonna go with a little bit of a look up and just kind of pulling through with that Theracane. You're just wanting to kind of push the arms out whenever we're holding on, little look up. We can also do with a little rotation. You can go either direction, just kind of whatever feels a little tight, a little sticky. And you can adjust where you're at. If you're nice and high up in the neck, if that's where you feel the tightest, you can use it up there. If you're a little bit lower on the neck, that's where it feels the tightest. You can definitely keep working down until you get those spots worked out to try and get them to loosen up. This is a really good way to get those joints moving. The joints are usually gonna be what are gonna limit that overall rotation. But sometimes it can be muscle. There's a couple ways to differentiate that, but I would work on a little bit of both. So that's gonna be more specifically for the joint. The way that you can work on the muscles with this is you can kind of go in, you can kind of hook this onto the shoulder, and then from there you can just kind of lever it up. And as you kind of go up, you're gonna get this kind of raising effect where you're getting this release of that muscle, just getting that little bit of soft tissue glide as you kind of lever it off the shoulder. I like doing that because it's nice, steady, controlled as opposed to trying to pull it. A lot of times it'll kind of wobble around. Those neck muscles aren't that big, so it'll tend to slip off. Or same thing, it's really hard to just kind of go in and just kind of go all over the place. So having that little bit of an anchor and then adding that glide feels a really good way to get into those muscles to help out with the neck motion overall if your muscle is nice and tight along with the joint. Next one we're gonna go through is gonna be a little banded mobility. This specific sleeve has two nice little nubs. These are gonna allow to get onto those little bony prominences to get that extra motion that you need. So we're gonna take this, it's gonna go behind the little bumps right in the center of the spine are gonna go right into the middle of the back. From there, we're just gonna go hands into the little handle and then add that little bit of rotation, just letting the band kind of pull. So we're kind of anchoring with this arm, and then we're kind of pulling those little nubs into those little bony prominences, and then that's gonna allow us to get a decent amount of motion overall to get that moving. Same thing with the Theracane. You can move it up and down. There's no real right position. It's where you feel the stiffest. That's where I want it to be. And just coming through that motion, coming through that rotation. If you want, you can do a little bit of body as the neck stays relatively still. That can mimic some of that swing motion as well. So if you're kind of pulling through a little bit more with the shoulder and kind of giving that body drive, that can help to improve that overall neck motion as well, as we're doing a little bit more body as opposed to just moving the neck. Other thing that you can do with this is just nice and easy, little bit of light traction. So you're just taking the elbows and just straightening them out. Just nice, easy into kind of that back of the neck, just to kind of let everything elongate. Just try and relax, get that nice little pull, get that nice little bit of traction going through the neck. Usually feels good. It's not gonna fix a lot of the rotational deficits, but it can really help to relax those muscles and get those joints to just ease up a little bit so you can get more motion as you go through that rotation to try and help overall with your swing. I hope this helps. I hope this gives you some ideas of how to fix your neck and get it moving better overall to help with your golf swing. If you like this video, make sure you like and subscribe to our YouTube channel so we can keep bringing you videos to keep you living an active and healthy life.